headlines from an African perspective.
Indeed, at 23 minutes past 9, let's get into the issue of climate change. Rising heat waves, floods and droughts are putting Africa's health systems under growing pressure. In Nairobi, the World Health Organization and the Africa Enterprise Challenge Fund recently hosted a regional workshop to explore new ways to finance climate resilient health systems. Today we speak to Dr Jeremiah Mushosho, WHO Africa Regional Team Lead for Climate Change, about how the initiative aims to protect vulnerable communities. A very good evening to you, and thank you so much for speaking to us.
Good evening. Thank you so much for having me.
Perhaps to just give a bit of context, what are the trends that you are seeing in the region and in these countries that you are working in?
Thank you so much for the opportunity. You might be aware that climate change is one of the single biggest threats to health and well-being of the people in Africa. You may have heard that for the past 2 decades, there were more than 2,200 public health events, and 56% of those events were climate-related. We have seen a surge in climate-related diseases, for example, cholera, malaria, and other diseases which have been worsening, and their breeding periods have been changing due to climate change. And we have seen an increased burden of these diseases. And because these countries are less prepared in terms of their health systems, we have seen that the climate risks are quickly translating into disease burden and death in all these countries which we have selected.
And it's interesting to see that in some countries, unions are pushing for what they call a legal working temperatures. Now, as you say, there's still a lot to learn and glean from in terms of these emerging trends. So in Africa, do we have the luxury of saying that there must be work stoppage under such conditions, or what alternatives are you helping with to ensure the safety of workers in general?
Thank you so much. While the debate is going on, climate change impacts are raging. Africa already has limited health workforce, and the health workforce is being exposed to working conditions which are not healthy for them, and therefore they are not able to render the services to the communities. So we have seen that while these discussions are ongoing, we urgently need to take action to protect the workers who deliver services to the communities. So they are facing quite a range of these problems, and what we have done through one of our frameworks, building climate resilient health systems in Africa, we are rallying behind capacity building for the workforce so that they are able to detect, to treat, and to manage climate-related diseases which have been increasing, and we have seen that more and more health systems are breaking down due to these impacts, rendering the health workforce not being able to effectively provide the services which they need to provide.
And a lot of that surely has to do with civic education. So whilst you're protecting health workers on the ground to ensure that you don't overburden the health systems, what tools are they being given to be able to teach communities how to protect themselves, and especially those who are vulnerable?
Information is key indeed, and how we put that information across is also directly linked to how that information is received and used. So we have more than a couple of times discussed with governments to ensure that their training curriculum for the health workforce is aligned to climate resilient health systems, thereby providing them an opportunity to be quite aware of the risks which are there, and also as they interact with the communities, they are able to provide them with the information. What is key right now is to provide practical solutions to the communities. So we are working with the health workforce to be able to give advisories to the communities which will really help them. For example, you have seen that there have been a lot of heat waves. We need to be able to help the communities to adapt. So the health workers are actually equipped to be able to disseminate information which will help the communities to say, how do you adapt to heat? What actions should you take? And what practices, for example, dehydration and many other practices, which would help them in their daily lives. We don't need to tell communities about greenhouse gas emissions. we need to tell them practical solutions. What do they do during the spread of climate-related diseases such as malaria, such as cholera, and during heat waves? What do they do to manage persons who have underlying conditions? How do they treat those situations? So those are some of the practical tools which we have been delivering to the health workers for them to be able to disseminate further to the communities.
The WHO says something in the region of 2.4 billion people worldwide are exposed to extreme heat conditions. And this has, as we mentioned, led to drought and the emergence of diseases such as cholera. But there's also the issue of agricultural labor productivity. People facing starvation and limited resources would still want to go out there and save their crops. So it's more a matter of necessity. What training and education do you give them in this case? Because they're trying to protect livelihoods as well.
You may want to know that the intersection of climate change and health involves quite a lot in terms of the impacts which are being translated into the daily burden of problems within the communities. And food is one such issue which we look at from our nutrition perspective. We understand that agriculture systems need to be climate proofed. So we are working with communities and governments to make sure that we deploy practices such as climate smart agriculture, which would guarantee the communities that they are able to at least produce for their own consumption. Because to adapt to climate change, we need to adopt new practices, especially in the agriculture sector. We have seen quite an increase in the design and implementation of climate resilient irrigation systems. But at the community level, for those small-scale farmers, there's been a move to promote drought-tolerant crops and also to ensure that we prevent post-harvest loss and also to ensure that farmers are able to diversify in terms of their crops so that they continuously get adequate nutrition which they require over and above just food. So these are some of the key messages in some of the line of work where we have been promoting to make sure that communities, small-scale farmers, are able to continue to produce and provide for themselves the nutrition which they so require during this difficult time where climate change is really derailing every single endeavor to achieve sustainable development goals, including food security and nutrition.
All right. And Dr. Mushosho, hopefully next time we'll speak about innovation, technology, and employment opportunities while you tackle these challenges. Dr. Jeremiah Mushosho, WHO Africa Regional Team Leader for Climate Change, brings the time to 29 minutes to 10.